Hi, my name is Jose Miranda Velasquez. This video is for BSN 225-21. This video is the administration of intramuscular injections. I'm in my nightingale scrubs. You can see my badge. I want to point out I'm using my cell phone and a tripod to record. So I may need to make some adjustments. To start off, I gather my supplies. First, I have my medication vial, pair of gloves, gauze, alcohol wipes. Next, I have a syringe and a needle. I want to point out I'm using a 3 milliliter syringe. And either I could use a 22 gauge or a 25 gauge, which for this case I'm using a 25 gauge, 1 to 1.5 inch needle. My equipment's already open and used. I wanted to point that out as well. They're used from practice. So essentially my supplies are ready to go. Next, I will verify the 6 rights of patient administration. I have the right patient, the right medication, the right dose, the right route, the right time, and then the right documentation. After that, I do need to do a verification check of the medication with the EHR. This is the first step to verify the medication with the MAR. I need to check 3 different times before I can administer any medication to the patient. This is 1 out of the 3. In this case, the medication order for the patient, or for my patient, is a morphine sulfate injection. The order reads 1 dose of 6 milligram IM or intramuscular. The calculation, and I have it here on a post-it, there's nothing on the back, reads 1 milliliter over 4 milligram because 4 milligram is what I have on hand, and the order states for 6 milligrams itself. So it's 1 milliliter over 4 milligram times 6 milligrams. And when you cross multiply, it brings it out to 3 over 2. And when you divide it, brings it out to 1.5. So it's 1.5 milliliters of morphine sulfate. Okay? Once that is done, I will gather my supplies, my medication, and head towards the patient's room. I will knock, enter, close the door behind me to ensure patient privacy, and avoid any HIPAA violations. Set my supplies down on a clean, dry, flat surface and perform hand hygiene. Introduce myself to the patient. Hello, my name is Jose. I'm a nurse here. Can I have you state your name, date of birth, and medical record number if you know it? Then I would check those with the patient's wristband to make sure they match, as I do need to verify the 2 patient identifiers. Thank you, Mr. Miranda. Are you allergic to any medications or anything that we're not aware of? No? Thank you. Now that I have verified my patient information, I'm going to check the medication again with the MAR. This is the second time in checking it. And I would proceed. Okay, Mr. Miranda. As you can see, I have a medication here, or an injection. Your doctor ordered medication. They ordered you to have morphine sulfate injection. And I wanted to talk about the mechanism of action for this medication, as it binds to your central nervous system and its receptors to alter the perception of the painful stimuli. The idea is to treat the moderate to severe pain that you are experiencing. Now, there are some common side effects that comes out with this medication, and they range from nausea to constipation, and at times drowsiness. So they are common, and if you start to experience these and you feel they're getting worse or it's prolonged, please do let me know. Also, if you feel like you're going to pass out or if your heart's racing, something seems abnormal, that might require immediate medical attention, so please do let me know. We'll notify your doctor. If you were to start experiencing some of these adverse reactions, I do want to let you know that we're going to do a full assessment. We're going to obtain a set of vitals. And assess your heart rate, assess your blood pressure, and go from there. So if you start to experience any of these, please do let me know so we can notify your doctor immediately. I also want to let you know that upon administering the medication, you'll feel some slight burning and a stinging sensation as the medication is going in. This is normal, okay? Do you have any questions for me? No? Okay, thank you. All right, at this point, I would go back and verify the medication with the MAR, the third and final time. Once I'm done verifying, I will perform hand hygiene. Put on my gloves. this point, I want to clean the top of the vial, the medication vial, with the alcohol pads and dispose of them once I'm done. I need to open my syringe and attach the needle. The needle's attached. And again, I'm using a 3 milliliter syringe and a 25 gauge 1-inch needle. And I will I just place it onto the end. I just twisted it on. So I want to drop or add the amount desired of air into the syringe. So I want to hold it up like a pencil with the needle up and the cap still on. And I'm going to draw 1.5 milliliters of air. There is a little bit of the medication in the syringe from my previous practice. So I'm going to assimilate that there's nothing in there. I wanted to point that out. I'm going to bring that up close to the camera. That's 1.5 milliliters. And I want to take this air and inject it into the vial and then draw up the medication. As I'm drawing up the medication, I will invert the vial and draw the medication at 1.5 milliliters. I'm going to remove my cap. Take my vial, inject the air, 1.5 milliliters. Take my vial, invert, and we'll draw the 1.5 milliliters back of the solution. All right, that's on. Oop. Nope, there's air. I'll push that all back in and attempt my redraw again. Get the air out of the vial. All right, 1.5. And I will cap my syringe, my whole needle, using the swoop method. All right, it's on. My syringe is capped. My medicine's ready. 1.5 milliliters. Next, I need to look at the site of where to give the intramuscular injection. There are 3 places this can be done. It can be the deltoid, the vastus lateralis, or the ventral gluteal area. My patient for this case wants the ventral gluteal area. I want to use anatomical locations to pinpoint the exact location of this injection. So I'm going to use the heel of my hand. I'm going to place that on the body. And I'm going to put my thumb on the greater trochanter area and point it towards the groin. Well, the heel of the hand will go into the trochanter area, and I'm going to use the thumb to point. Then I'm going to use my index finger to point towards the iliac spine, and then the middle finger towards the iliac crest or the buttocks. And I want to create a V triangle shape, which will create the injection site right in the middle of the triangle, essentially. So, right here in the middle of the pad. After finding my location, I need to assess the site. I want to check for the muscle for size, integrity. I want to look to see for any signs of bruising, irritation, or edema. I will then gently palpate. And I want to look for tenderness or any hardness. So, in this circumstance, the site is acceptable. I will then take my gauze, or pardon, my alcohol pad. I will clean the site in a circular motion from the middle to the outward, 2 inches. I will dispose of the alcohol pad. Once I clean my site and that it's ready to use, I want to let it air dry. I don't want to touch it. So I'll give it a few seconds. Now that it is dry, I can move on to the medication. With the syringe, I want to hold it in between my thumb and my index finger. My cap's on. And I want to remove the cap like a dart almost. And I'm going to inject it at a 90-degree angle, palm down, using the ulnar side of the hand to apply tension to the skin so I can make, well, I'm going to inject, but I want to use my non-dominant hand to apply pressure to the skin so that I make it nice and tight. Almost as if I was using the C method with my fingers to spread it without touching the injection site. And I want to come to the skin at a 90-degree angle and inject. So I'll use my 2 fingers on my non-dominant hand to stabilize the syringe. So I'm going to go ahead and remove the cap. I want to use my C method. Have my skin, my area, like a dart. Go ahead and inject. At this point, I want to use my non-dominant hand to hold. And I want to pull back on the plunger about 5 to 10 seconds to see if there's any blood. There's no blood. This means that the syringe is, or the needle is in the muscle, and I'm going to proceed with injecting the medication to the patient's muscle here. I want to inject 10 seconds per milliliter while still holding pressure on with the ulnar side of the hand. So here we go. Okay. I'm done injecting the medicine, and I want to leave the syringe for 10 seconds before removing it. So now I'm going to remove the needle after the 10 seconds are up, and I'm going to release the skin and place the gauze pad on top. All right, here we go. I have my gauze pad. I'm removing the syringe with the needle, and I'm putting my gauze. And I'm quickly disposing of this into my sharps container immediately. So my sharps container, that's good to go. Going back to the site of injection, I want to make sure I don't rub or massage the site, but I do want to check on it, make sure there's not any bleeding or anything abnormal. For this case, there's none. So no need for a band-aid. There's no blood. I can go ahead and proceed to start cleaning up and dispose of the remaining items. I want to check on Mr. Miranda as I'm removing my gloves. Mr. Miranda, how are you feeling? Are you comfortable? Yes? Okay, great. So the patient states that he is comfortable. The call light is within reach. The bed is in a good position. I already removed my gloves and tossed the trash. So, clean my work area. I will perform my hand hygiene, document my results, and notify the doctor of anything abnormal. All right. Thank you so much.